When was the last time you saw your dentist? Better yet, when was the last time you flossed? Today I'm here to talk about dental hygiene and how poor oral health can lead to systematic diseases. The types of diseases caused from bad oral health is cavities, gum disease, and oral cancer. Cavities happen to a lot of people. It's very common, and it's caused from not brushing your teeth regularly or flossing. Sugar and coffee and a lot of those high caffeinated foods and drinks are what cause cavities. Gum disease or periodontal disease is infection and bacteria under the gum lines from not flossing at all. And oral cancer can happen through genetics or just not taking care of your mouth as you should. What is periodontal disease? Periodontal disease is basically gum disease. It's one of the most common types of health diseases caused from poor oral health, and it starts off as gingivitis. The longer the gingivitis goes untreated, the longer and stronger the periodontal disease can grow, and it can happen to anyone regardless of age, sex, race, or anything. It's really just caused from bad oral health and smoking. Here's a diagram of what a healthy smile should look like and what periodontal disease is. Healthy gums should look like pink gums, healthy strong teeth, and good smelling breath. Periodontal disease is visible decay. You can see here this tooth is coming out of its socket because all the bacteria is pushing the tooth out from the gum line. This is a tar buildup caused from the lack of flossing and the discoloration in the teeth. You can tell this guy was a really heavy smoker and definitely has bad breath because of that bacteria, and very loose pockets and teeth in those pockets too. 66% of people, young adults, have periodontal disease. 50% of children are living with periodontal disease, and this is worldwide. 200,000 people are diagnosed with periodontal disease every year. It's a very common thing. I feel like not a lot of ads promote healthy oral health, and this is why the numbers are so high. $4,000 to $10,000 worth of money spent on periodontal maintenance, which is deep cleaning after you have surgery or whatever the dentist recommends for you, and that's just in 2022 alone. I want to show a video of a woman who came into the dentist concerned about her breath and her smile. Her insecurities made her really depressed, and not only does periodontal disease cause other diseases, it causes depression, it causes lack of self-esteem, very high insecurities, and it's just not fun.
Of adults 65 and over experience severe tooth loss. This can be a symptom of poor oral health and a lack of affordable dental care. The consequences can affect people's overall health, including a negative impact on their social and emotional well-being.
When I meet someone, the first thing that I notice is their teeth. And they're looking at me, and I have this gap in my mouth. It's embarrassing. It's humbling. To me, that has been the biggest blow to my happiness on this earth, is me being toothless.
But if you're self-conscious or embarrassed about your teeth, you're not going to smile in a public situation. And for some older adults, it goes as far as they don't want to be out in any social interactions, preventing them from enjoying relationships with others, and can lead to real isolation and, of course, depression.
Today,
that cycle of poverty for that age group.
A much happier person, because I want to work, I want to smile, I want to be healthy. And I think in order to be healthy, you have to have healthy
teeth. As you can see,
teeth.
the woman was really distraught and really upset, but at the end, after getting her teeth cleaned and even a new set of crowns put in, she was really, really happy and pleased and was excited to show her smile. And that's really important in oral health, is to make sure that you are happy and healthy at the same time. So after you're diagnosed with periodontal disease, this is kind of what happens. So first is your diagnosis. You consult with a periodontist who specializes in gum disease to see if you need an SRP, which is a scaling and root planning, which is where they cut the gum line just a little bit and do a really deep cleaning to get the bacteria out. That's usually in mild and moderate cases. In other cases, you need an osseous surgery to perform, which is when they completely cut out your gum socket and replace it with bone graft and tissue membrane. It's a very expensive treatment, very expensive recovery, but a lot of osseous surgeries happen because of the lack of maintenance of their teeth. Next thing is the treatment, which is the cleaning or the surgery performed, and then maintenance. You see your hygienist after your procedure every 3 to 4 months for periodontal maintenance, which is really just a deep cleaning. But as you can see, it's a lot of maintain and a lot to do, a lot of money spent. This is why it's really important to just brush your teeth and you can save all this money. This is just patient care. This is what I show to a lot of patients that come into my dentist office, how you should brush your teeth, because a lot of people think you should just be brushing like this or like this, but that actually pushes the bacteria deeper into the gum sockets. You should always brush for 2 minutes twice a day, floss once or twice a day daily, and brush at a 45-degree angle. And you want to press firmly on your teeth, but not too hard where you can damage the enamel, which is the outside of your teeth. And you want to floss right on the gum line, not just around the teeth. That's how you really, really get all the bacteria out. Why is it important to learn about periodontal disease? One, it's because it can happen to you. It can happen to your mom, your dad, your sister, brother. It can happen to anyone. It's really scary. It could be life-threatening depending on how severe it is, because a lot of people don't know gum disease really is a high reason why Alzheimer is a thing. Tooth decay, it can cause your teeth to fall out, really bad breath, and other systematic diseases such as diabetes and whatnot. It's really important to take x-rays at least once a year just to see if you're improving with your oral health or declining, and it's really important to know what type of maintenance your mouth needs. Next thing, your dental checkup. You have to definitely see your dentist every 6 months, even after you had that surgery or scaling and root planning done. You definitely want to see every 3 to 4 months or every 6 months just for a checkup and an exam. Types of diseases that cause periodontal disease, because sometimes periodontal disease can just happen with poor oral health, but a lot of diseases cause periodontal disease, such as smoking, tobacco use, genetics such as epilepsy and diabetes, clenching or grinding your teeth, and poor nutrition or obesity. So all of those are really common factors of how periodontal disease can start and can form. It's really, really important to, if you have epilepsy or diabetes, to take your insulin and go see a dentist as well as you see your doctor. And same with people with obesity and smokers. Thank you so much for watching, and if you have any questions, please let me know. And here are all my sources from where I got my information for you guys today.